Hello everyone. Hello everyone. This is Dr. Poornima, founder and owner of Hills Dental Design. Today's topic is about bone graft. So you want an implant, a dental implant, and you've decided, yes, that's a good option for you. However, in the CT scan, we say, well, you don't have enough bone. What does that mean? And how can we resolve this problem? So if you don't have enough bone, you can still do a dental implant. So we do have some options about bone grafts. So the first option you've got for the bone graft is called an alloplast. And alloplast means that we just sort of, make it's a man-made synthetic graft which we can put inside the cavity where we need to form new bone, and then we can place a dental implant. So the second thing is where we can harvest the bone from an animal, and most of the times it's from a pig bone. So what we do is we harvest that. It's already comes in, it's already made. We mix it with your blood, and then we use your existing bone as a scaffold, and then we put this material in. It is quite successful with the pig bone because what it does, it eventually the pig bone will turn into the human bone, and we like the quality of the bone which gets produced. So we quite like that. So there are two types of bone, which is a synthetic bone, which is man-made bone, and that is also mixed with your blood, and then we've got the pig bone as well. Now then what we do is we use a membrane. A membrane means that we actually, when we pack the material in, now for example, imagine that you've opened up the gum and the tissues, and then you're packing all this material in, and we try to allow the body to heal. When the body heals, what happens is the connective tissue and the epithelial tissue, which is the gum tissue, tries to take over because they actually grow faster than the bone. As you know, bone is the most slow growing, so it takes up to 3 months for it to grow, and 6 months as well. So that's why the wait time is between 3 months to 6 months. So while the gum tissues, which grows faster than the bone tissue, if we want to avoid that, we use something called a membrane. So we use the graft side, the membrane, and then so that we can just divide the epithelial tissue, which is the gum tissue, and the bone tissue, so that bone can grow very well. The other one, which is recently people are using as well, comes from a human body. Okay, so that's called an allograft. The allograft it comes from another human body, so it's already there available for us because it's from a cadaver, and it's gone under strict, very, very strict the process, so that we know that it's a good quality bone, and then we use it. So if the defect is a little bit big enough, and of course we need your consent to use that material, we can use that for you. The only thing, of course, is that there is a very small risk. We always have that risk that what happens, it's made up of someone's bone. What if they had certain diseases, etc., etc., and you may not be comfortable with it. The last one is where you've got a massive loss of bone. So I've had patients who say, well, they've had dentures for 20 years, they want to do something about it, and unfortunately they've lost a lot of bone. And when they do lose a lot of bone, we can't use these techniques and these materials. So then we need to have a specialist involved. And what does a specialist do? They might, if there's a massive loss of bone, harvest bone from your own body. So it's normally done from the maxilla or the mandible, that's the upper jaw, the lower jaw if possible, or the ribs, or the or the leg. So what we do is we end up having a massive, comparatively a good chunk of bone grafted from your own body from another side. Now, of course, that means that you have to go possibly under general anesthetic. The problem is that because of the size of the bone, it might take or it might not take, because we are looking at quite a bit of, bone loss here, and also the healing time as well. So it may not integrate very well. So if it doesn't integrate very well, then it's not going to work. And also it is another surgery. So say for example, for the first two options or even three options, what we do is we do it on the day, and we do it sometimes while placing the implant. So the bone graft site, the position, depends on where exactly how much bone loss you have. So the bone loss is severe, then we will have to do something more drastic, which means that we will just graft the site first for you. So we fatten that area up, we build bone first, we allow that to heal for 3 to 6 months. Again, the time depends on how much bone structure is required, and then we place an implant. But if you're losing around 10%, 20% of bone, and you've got your walls, that means the walls of the bone intact, then we can place an implant and pack the material around it. So if you want to just pack the material around it, we can use the xenograft or the allograft, which are the ones, the xenograft and the allograft can be used, and as well as alloplast. And these are all technical terms. That means you can use a pig bone, you can use the artificial bone, or from a human bone if you want to graft the side. The human bone we normally like if it's a little bit more sort of bigger, the site, the defect. And then of course we can graft, and that can all be done on the same day. So those three graft materials, we can do it on the same day and place the implant as well, provided you have enough of your original bone. But if we are looking at, well, we don't have enough bone, what we are going to do is we are going to wait it out for 3 to 6 months. We're going to pack it all in, the material, and most likely we are going for the alloplast or the xenograft, and we're just going to pack all the material in, and then we're just going to wait for it to heal, and then we are going to have an implant 3 to 6 months down the track. And if there's a massive loss of bone or there's a more defect, then we can use another material or the bone from a different part of your body, and the wait time is around 12 months to 18 months. I hope it gives you an understanding about what are the different types of bone material. So just to sum it up, because I know it's a little bit technical, so it can be made up of, it's man-made, so it's synthetic, or it can be from pig, so bovine bone. It can be from another human, so we can use the human bone, and your own bone, which is from different part of your body. And of course that means that it's a lot of bone is missing. And depending on how much grafting we are going to use, the wait time is between 3 to 6 months. If the graft material is just not a lot, so 20 to 30% you're just grafting, you can possibly place the implant in. Or we do 3 to 6 months of wait time by packing the material and fattening the bone, so that way implant can be placed. Or we need to wait for 12 to 18 months if you're grafting from different side of your body, and then we place an implant. And the wait time is to make sure the bone has formed and the bone has healed, and then you're ready for the implant procedure. Now, thank you once again. I know it was technical, so please comment, share, or like, just to for me to know what topics you're interested in. Now, also remember, at Hills Dental Design, we are offering a free implant consultation. If you want to make use of that, please feel free to call us on 0294841913 or email us at info@hillsdentaldesign.com.au. Thank you for listening. This is Dr. Poornima Srinivas from Hills Dental Design, where beautiful and healthy smiles begin. Thank you. Bye.